Good evening, everyone. Thanks for coming. And really, it is a really lovely evening. And I'm so happy to see every one of you. So we can have more exchanges after the talk. To begin with, let me introduce myself. My name is Catherine So, a professor at the Chinese University of Hong Kong. And I graduated quite a long time ago, almost 20 years. I graduated in 2007 in Department of Psychology. And my PhD supervisor is Professor Susan Goldman-Medal. And my PhD training was in gesture production in adults and children across cultures. So I kind of changed my career path working on autism research. Also, I will share with you more later. So before I start my presentation, I would like to say a few statements. This workshop is sponsored, this talk is sponsored by Nexus Asia program. And Nexus Asia is a program initiated by University of Chicago Hong Kong campus, dedicated to collaborating with University of Chicago PhD alumni and their institutions throughout the Asia Pacific region. Okay, so let's start. And today we are going to talk about how our lab and team deploy social robots for the purpose of rehabilitation for the children with autism. So as I mentioned to you, I'm a professor at the Chinese University of Hong Kong. And at the same time, I'm also a founder and director of a charitable organization, Star Limited. So I'm sure that most of you, when you come here, you have grabbed our souvenir. So it is a little gift from our organization. We hope that you will enjoy. And you also grab a leaflet documenting or describing or summarizing the services that we provide in our charitable organization. Hope that one day, we have more exchanges in this organization, and feel free to visit too. Okay, so a little bit disclosure. The findings shared in this presentation were coming from the studies funded by these research grants and also the grants on the social services. So to begin with, I would like to show you a picture of a boy, okay? I would like you to use one word or two words, it doesn't matter, to describe this boy. Any words will do, okay? You can describe his feelings, you may describe his facial expressions or some background images as well. So feel free, use one word or two words to describe this boy. Hands on? Okay, yeah, there's a hand, yes. So what does it mean to you?
It means that somebody's involved with them.
Somebody's involved with them, great. Any others? Distracted? Yeah, good point, yeah, looking away or looking somewhere else. Definitely not communicating with others, right? Any others from this side?
No, it's overwhelmed.
Overwhelmed? How do you see so?
I can feel that. Like,
yeah, you can feel that. It's a feeling. Thank you. Overwhelmed, distracted, somebody's hands on him. Okay, why did I show you this picture? I want you to get a sense of, what an autistic child would look like. I know that, autism is a heterogeneous developmental condition. So there are lots of the individual variations here, right? But a typical or on average, an autistic child may, behave or may look in this way. So you can see that his eyes will look somewhere else, but definitely in this picture, not on other human beings. So he may prefer looking at the sky or looking at other objects instead of, those with the, feelings and emotions like human bodies. And another thing is that you would notice that some hands are on him. So which means that these individuals, or maybe adults, their parents or their friends, they may take the initiative to interact with this boy. But unfortunately, this boy may not, eager to respond, or may not even know that somebody is trying to interact with them. Okay, so a lot more of this kind of the interaction may definitely make this boy overwhelmed. So I can see your point. Why I show you this picture? because a lot of the traditional interventions involve human beings or human therapists to implement the interventions to the autistic children. And these human beings, they will serve as role models to these autistic children, helping them to learn appropriate behaviors, or we call social norms, so that they could be easier for them to interact with the world or interact with others. So modeling, it is one key component in the social learning theory proposed by Bandura in 1977. It is a really old theory. And back to that period of the time, of course, human beings would be the main models for the children to learn social skills. And now let's put his theory in the context of autism. Would human only, I would say only, be the models for the autistic children? So given the picture that I just showed you, and also the theory I'm going to talk about, the social motivation theory of autism, meaning that these individuals, they may have the deficits in communicating with the humans, okay? They're not quite motivated to engage with the human beings, so in other words. Another theory that I really love most is the intense world theory. It is not about the motivation, it is about how they perceive the stimulations when they are interacting with others. According to this theory, these individuals are born with excessive reactivity due to a particular form of the brain impairment during the pregnancy. So they may be overwhelmed with the touch, with the human touch, or they may be overwhelmed with the human emotions or tones or facial expressions and eye contact. So I really love this theory because we know that many autistic children, they also have the sensory issues, hypersensitive or hyposensitive. And the third one, so given that human beings may not be the only models that could help out the autistic children, how about other types of the teaching agents? So according to Baron Cohen in 2009, robots could be operated on predictable manner, and which provide a favorable learning environment for the autistic children. These robots, they have some key features. They can be programmed, and of course, they could not move on their own. I know that AI is emerging. Maybe 10 years later, 20 years later, they have their own, this robot may have their own mindsets, they have their initiative. I know that, but at this moment, they still need to be programmed by the human beings. So making the robots really predictable and the procedures will be replicable. Okay, so in our social services, in our services provided by our charitable organizations, we have 2 robots, not these 2, but another 2 robots sitting in the classroom. And then whenever the kid enters the classroom and see these 2 robots, they would know that, okay, lesson begins. And then they will greet the robot teacher. Hello, Sky. Hello, Dash. Okay, so that is really predictable. And then they will also know what the robot would say next. Okay, but of course, somehow parents would be worried that would they make the kid even less flexible. We can talk about that later. Okay, another key things is that these robots are not, I would say, yet affected by emotions. During the therapy section, imagine in a scenario that the autistic child is interacting with the human therapist. The human therapist try to make some commands and hoping that the child will follow. Of course, this is not that easy. Making that both parties, they are emotionally overwhelmed, okay? There is one time that I observed how a special school teacher taught simple vocabularies to an autistic child. And maybe it should be after only 5 minutes. And then the teacher's voice is gone. And they're feeling so frustrated. Okay, and then the child also felt very frustrated too. So this is like they are affected by the emotions. And also at this moment, the robot are not yet able to express the emotions, okay? Somehow we actually right now we have quite a number of the autistic children. At the same time, they also have the anxiety issues. So some possible reason is that, again, in that scenarios, when the therapist feel anxious, the therapist will have a lot of the facial expressions, right? The anger, helpless, and powerless. You know, there's also typical teacher of Hong Kong. And then when a kid sees this kind of the face, the kid will also feels very frustrated. Okay, so but if the kid is interacting with the robot is not yet able to express the emotion, that will make the kid less anxious and more willing, you know, to engage with the robot, listen to the commands, and taking the class. Okay, so that is the reason why we design robotic intervention. So the name of the intervention is a Robot for Autism Behavioral Intervention, in short form RABI. And when I create this name one day when I took a training a few years ago, and I tried to make a title that it will include it refers to a teacher. So that's why I use the word RABI. But then I will fill up the, you know, put in the RABIs that R stands for robot, A stands for autism, and so on and so forth. So you know, in Bible, RABI means teacher. So I want the robots to become a teacher and also the learning companion of autistic children. If you know Chinese, 幾個半小星, so you will see the keyword 半, which is I really hope that the robot is not only a teacher, but also a friend, a companion for our autistic kids. So here comes some empirical evidence. You know that I'm a researcher. I hope that the services our team and I provide to the children, they are all evidence-based. So all built on the scientific evidence. So we started this line of the research back to 2015, and it is already 10 years journey. And we look at whether the robot is effective in improving gesture communication skills. And as I mentioned, I'm trained as a gesture researcher, although I kind of changed my career path. Joint attention, eye contact, the pain blocks refer to the nonverbal communication. And then the right sides refer to the verbal communication, conversation, narration, empathy. So we have just recently published a paper on how the robot enhance empathetic response to the autistic children. So let's start with the gesture communication skills. You know, gestures, they are the spontaneous hand movements. We move our hands when we speak, okay? So these gestures are very important. They are the really important milestones for children's language development. And not only for the typically developing children, but also for the autistic children. I know that there are not a lot of numbers here, but don't worry, the key message I want to convey to you is that CDG, which is the child directed gesture, child pointing gesture. And this pointing gesture could predict their mean length of utterance, which is number of the words in the sentence, number of the types of the words, and total number of the words, which is word types or tokens. Okay, so autistic children's pointing gesture could predict their language development. Okay, so this is a longitudinal study. Over 9 months, we track their language development and gesture skills over 3 and 4 time points. Okay, so that is one of the reasons why we need to intervene autistic children's gestures. According to the literature, their gestures are kind of lagging behind than the typically developing children. But one complicated thing is that, as I mentioned, autism is a heterogeneous developmental condition, right? So there are a lot of the individual variations here, even in the gesture production. So if you see this radar plot, you will find that group 1 and 2, which is we look at the gesture per utterance here. Group 1 and 2, they have a kind of deficits in gesture production. You can see negative 0.05, which is number of the gesture produced is below average of other autistic children, among other autistic children. So this group of the children particularly need intervention. Of course, group 3 and 4, they are pretty good, above average. Okay, so we also hope that when we provide the intervention to autistic children, we could make good use of the resources. Screening first, and then provide the intervention that they need. Okay, so here comes out of our first intervention study. Using the pre-test, post-test design, it's not an ideal design because usually in intervention, we should use randomized control trial But at that moment, we don't have a lot of resources to do that. So this is like a test trial. So we deliver a 4-week robot animation training program. So this is the, let me show you the, so this is the, sorry. Oh, sorry. Animated robot to demonstrate the hand gestures. So is that, let's take a look at this video and then find out the meaning of this gesture. This is hungry. This is hungry. Okay. So we administer this 4-week robot training them to understand the gesture, the meaning of the gesture, which is gesture recognition. Okay. And the second phase is to imitate the gesture. So to imitate the gestures produced by this animated robot. And then in phase 3, to produce the gesture in a sentence format. So during the break, I feel so hungry. Okay, so this is we have the multi-phase intervention in this study. And the pink bar refers to the score they got in the pre-test. And then the 2 other blue bars refers to the scores they got in the immediate post-test, which is post-test 1, and also delayed post-test. So to summarize, we find that just 4-week intervention program, these children got significant improvement, statistically significant. I didn't show it, the numbers here, but the difference is significant in recognition, imitation, and production. Of course, there are individual variations. For those who could succeed in this intervention program, they got more or higher abilities to imitate the gestures. And why some children would have a stronger abilities to imitate, because they maybe would have a better social communication skills. And interestingly, if these children have better visual motor integration skills. Okay, so it will be easier for them to imitate the gestures from the robots. A couple of years later, the faculty funded me 2 robots. So it is really the physical robots. So these robots are programmed to produce gestures expressing feelings and emotions. So you may wonder why we focus on feelings and emotion, because we know that autistic children, when they feel upset, or they may feel noisy or hungry, they may hurt themselves, cover their ears, or banging their heads towards the walls, which are commonly known as the challenging behaviors. Okay, so that's why we would like to program the robots to produce all these gestures, teaching them, okay, when you feel noisy, you just really gently cover the ears. When you feel hungry, and then you could produce this gesture instead of screaming. So that is the purpose of designing this study. Again, also 4-week robotic intervention. You may wonder why always 4 weeks, because students are busy. Parents are also busy. So we try to make it, intensive. And different from previous design, this one is definitely a randomized control trial, a quasi one, because we, instead of, completely drawing lots and then assigning children to 2 conditions, we need to match them in terms of the age, in terms of the intelligence. So that is a quasi randomized control trial. It's not a really real one, but it's difficult to conduct a really real RCT trial. And the pink bars again refer to the scores they got in the number of the gestures produced accurately. The criteria is quite strict. We use the sign language criteria, the 4 parameters: the shapes, the movement, the directions. Really strict parameters. So let's take a look at whether they improve after the intervention. Yes, they did. So this is an immediate post-test, and such learning outcome, positive learning outcome maintained over time, which is 1 month later. Okay, so let's take a look at whether they generalize. I know that you may be more interested in the generalization. So let's take a look at whether they could generalize the learning outcome to their daily lives. The teachers are very good, helping us to, frame the students after the training. So let's take a look at the right one, the last one.
卓然，你做咩事唔入
Why
去禮
didn't you
堂
go to the
啊？
hall?
淨覺得
I
好
feel
嘈。
so noisy.
哦，咁老師幫你啦。
Now I help you out and take you away. This kid, whenever he felt noisy, he would hit the head like this. Always, for already 3 years. And now just only 4 weeks lesson, he learned this gesture and no more hitting the head. So we feel so proud of him. Next one.
耀希，早晨。
Why didn't you run?
早晨啊，
做咩企喺度唔跑啊？
好熱
I
啊！
feel so
哦，
hot.
唞下先係咪啊？
This boy was really amazing. So during the training, should I use the word stubborn? But anyways, he really insists on using his right hand to wipe the forehead because he would like to follow, what the robot was doing. So there's one time he used the left hand. Oh, no, right hand. Okay, so that is, but that's good. I mean, it is like he could imitate the robots well. Okay, now we find some findings that showing that the gestures produced by robot could help them to learn the nonverbal communication skill. Well, the next question would be, if so, are there still any difference between autistic children and typically developing children, which is non-autistic children, in terms of the gesture production? So that's why we conduct this study in a few months later. And this is also a quasi-randomized controlled trial. But different from the previous study, we add one more group, typically developing children, shown in the blue bars. Okay, I will show you the videos later, but let's take a look at the graph. And S1, it is the story that we use for training. S2 is the new story. We know that autistic children, they have superior memory. Okay, so we don't want them to produce a gesture based on memory. We really want them to really learn the gestures and produce the new scenarios. That's why we have the S2. And our guesses were correct. We really find that in the immediate protest, they would produce a gesture based on memory. But in the new story, I know that the accuracy score dropped a lot, but it is on par with the typically developing children. And of course, those in the control group, they did not show any improvement at all. Okay, so let's take a look how this girl gesture, hungry in the test. She needs to tell a story at the same time gesture. What is the gesture? So this is the hungry. One day a friend visited me and she says she's hungry. Okay, so when should we intervene? Just for the gesture communication. I also know that this graph is messy, but that is how the data spoke to us. So my PhD student now graduated, Dr. Jiang, and published a paper showing that actually there are individual variations in the developmental trajectory of the gestures. So this is also a longitudinal study over 9 months and 3 time points. And then interestingly, we find that actually their gesture declined over time. But their language ability improved over time. So which is interesting because it's really different from the literature which suggested that gestures should predict the language development. We did find out these results, but when we trace the development of these autistic children, we find that do they still need the gestures? I don't know. As a researcher, I think more evidence needs to be collected. But here you can see that the gesture rates decline. So if we would like to answer the question when to intervene, it seems like really as early as possible. Otherwise, they don't need gesture anymore. They just rely on the spoken modality. Okay, so I have mentioned to you a lot on the gesture study. Let's move beyond the gestures. Okay, so starting from 2018, we try to study whether the robotic intervention will improve other aspects of the social skills by using robot drummers. Okay, so we would like to take a step forward instead of just asking the children to imitate the robots, which is quite boring. So now let's program the robots to play drummers. And the kid watch the dramas, and later on having a role play with the robots, and followed by having role play with the human experimenters. And I will show you a series of study and finding that the robot dramas will improve different aspects of the verbal communication skills, including conversation, narration. Okay, so let's take a look at this drama. So we were using now robots, although no more right now. So the left one is a tourist guide. The orange one it is a tourist. Now we play a drama. We didn't use the now robots anymore because they are not static. So you can see that they need the human beings to support them. But the kids were happy. So feel so excited. I come to Hong Kong for a visit. It's so awesome. I'm a tourist guy. Now it's the time for the role play. Now it is the boy's turn. Imitation. Exactly the same as what the robot had said. And the experimenter tried to prompt him, now you are a tour guide, you should take the perspective of the tour guide. But you know, autistic children have the difficulties like this. Only after 3 sections, then you can see the improvement. Think a little bit. What should I say? Where do you come from? Okay. Of course, we will be more excited that the kid would have a fluent role play with the human experimenter.
我係由法國搭飛機嚟香港㗎。頭先咧喺飛機度遇到氣流，架飛機搖嚟搖去，我覺得好驚啊！
So this is the gesture one. Are you okay?
我冇咩事，只係有少少頭暈。好彩頭先咧，我有戴好安全帶。
So this is the gesture for wearing the bell. Okay, it's pretty fluent. And of course, you can say that it may be based on memory. So that's why during the assessment, we didn't test the same dramas. We present them Sylvester and Tweety Birds story videos, and then we ask them to narrate the videos. Okay, so let's take a look at the finding. We compare 2 groups, robot groups and also the release control, and then we look at whether they will have more complicated sentences after intervention and whether they can add the cognitive inferences. For example, Tweety Bird thought that Sylvester was coming after her, and so that she ran. Okay, so the word thought. And whether they add the affective inferences. For example, Tweety Bird felt so desperate because of keeping traced by the Sylvester. Okay, so you can see that after the intervention, the children assigned to the robotic intervention group, they have more complicated sentences, adding more cognitive inferences and affective inferences. Okay, so and conversation, we have our outcome measures assessed in the parent-child interactions. So it's totally beyond the the role plays or the dramas. We ask the parents and the children to interact with 15 minutes across all time points. We have the standard toy sets, and you find that we can see that after the intervention, the number of the turns keeps increasing, and also the proportion of the conversation initiated by the children. So this is important. We do not expect that the children only to respond to the adults' questions. We would like them to take the initiatives to talk about what they want. And then, of course, we also measure how the children respond, but we can talk about it later. So about joint attention. Role play actually could be a really good method to improve the joint attention activities. When it comes to joint attention, it really relies on the eye contact. So the child needs to trace or to follow the eye contact, the direction of the eye contact of the parent, and then to take some action. So which is this we call as a response to joint attention. The last one, it is the initiation of the joint attention, which is how often they would look at something, for example, looking at the chair and then waiting for the experimenter to look at the chair as well. So this is the initiating of joint attention. So to put it in a simple way, we find that the children after intervention, they have the increasing number of the initiation joint attention behaviors and responding to joint attention behavior. But one thing I want to take note is that it seems like tier 2 is a little bit lagging behind. And we did find that children in tier 2, which is the second batch of the participants receiving intervention, somehow their social communication skills seems to be weaker. So back to the words I said, there are a lot of the individual variations in the autistic children. Some may learn faster, some may learn, slower. Okay, all right. And this is also another study, also using the robot drummers, particularly in trying to see whether it will improve the joint attention behaviors. And similar results were shown for the initiation of joint attention. And interestingly, this batch of the children already had their response to joint attention in the ceiling. So, which is quite difficult for them to, have further improvement. And not many changes in the control group. Okay, all right. Next question. So we started with some findings in the gesture intervention studies, and then we moved beyond gestures. We talk about the role of the robotic intervention in shaping other types of the verbal and non-verbal communication skills. And now it is ready for us to look for an answer whether robot teachers are more effective than human teachers. But before I disclose the findings, of course, you can see the findings over there. I should clarify that I am not, or we are not using the robots to replace human beings. And we know that human beings could not be replaced because it's the human beings who program the robots, right? And who administer the intervention. But robots could be the assistants. Okay. So in this study, we have a batch of the children from the special schools to watch the drummers, the robot drummers, showing the type of the gestures we call intransitive gestures. And we compare the robot group to the human group and see whether these two groups show different learning outcomes. It seems like a mirror, right? The findings. Actually, no difference at all. Okay. So as a researcher, we could conclude that only from this study is that the effectiveness of the robotic intervention is comparable to the human-based intervention, right? So the robots could be the assistants to the human therapists, sharing the workload and making our lives easier. But hold on, let's take a look at a little bit more. Another study, a really recent study published by my postdoc. And how about this? We look at other aspects. Empathy. It is a really super challenging study. We spent half a year designing the scenarios and on how the children respond to happy, sad, angry, and fear emotions. Okay, and we programmed the robots to perform the dramas, and we look at whether the social robots could enhance the different components of the empathy, including cognitive empathy, which is whether they could recognize the emotions of the character, affective empathy, which is whether the children could feel for the character, which is resonance, and pro-social behaviors, which is whether the children could produce or provide appropriate pro-social responses like sharing, helping responses. As you can see, after the intervention, we have 8 weeks intervention. So this one will be longer because we are covering 4 different types of the emotions. Okay, and for the cognitive empathy, actually both groups perform similarly, quite comparatively effective. For affective empathy, interesting results come up, and it seems like robotic interventions tend to have a more positive immediate outcome than the human-based intervention. For the pro-social response, it seems like they are quite comparable. Okay, so I think the interesting thing is when it talks to affective components, It is to feel for the characters. And in the robot dramas, maybe helping the children easier to feel for the robot than to feel for the human characters in the human-based intervention. So that may be one of the reasons that here, robot seems to be outperform a little bit than the human beings. Of course, they show comparable results in the delay post-test. Okay? Right now, we have similar learning outcomes in the empathy and also in the gestures. How about a little more abstract, eye gaze? We got different findings. So I will show you this video. Because we have, in this study, we programmed the robot to detect the eye gaze on direction of the eye gaze and also fixation, the duration of the eye gaze. Okay, so this is quite an advanced technology. So you can see that there is a camera on the belt of the robot. So this is a camera for eye gaze detection. And after gathering all these images, the images will be, uploaded to the cloud. And that is an engine over there to interpret whether the child is looking at the robot. Okay, so let's take a look at this, how it works. Similar to other autistic kids, just moving around, looking at this, looking at that. But miracle happens in 5 seconds.
而家機械人就會講第一個故仔。
你好，我想同你分享小明今小朋友眼睛望下。
Now this is the detection happening.
多謝你有望住我啊！
And throughout the section, it seems like the kid just got really attracted to the robot and sit still, okay, during the rest of the time. Anyway, so I want to show you how we detect the eye gaze. And the children were administered with 4-week intervention sections twice per week. And we see whether this kind of the intervention will improve their eye contact when they interact with the human beings. So in the pre-test and post-test, intermediate and delayed, we have the human experimenters interact with the children. So it is not the robot interacting with children, it is the experimenters in the assessment. Okay, so you can see that in the human-based intervention, so it is quite interesting whether they have, inattentiveness, not looking at the experimenter, we call it inattentiveness. They have inattentiveness duration a little bit longer in the immediate post-test. Perhaps it takes a while for them to consolidate the skills. So it happens in these two conditions. But in the delayed post-test, we have a really significant reduction in the inattentiveness duration in the robot-based intervention. Okay, so again, want you to bring your attention that this assessment is done with the human experimenters, not the robot. Okay, another study, it drawn attention using the robot dramas to intervene for the drawn attention. We also find that human-based condition seems to, robot-based condition seems to be more effective than human-based condition. So putting these 4 studies together, if we intervene for behaviors like empathetic responses or gestures, they are quite, how can I say? I don't want to say tangible, but they could be easily observed by the teaching agents. It seems like both robots and humans can do their job. But when you talk about some kind of abstract, like eye contact and drawn attention that relies on the eye contact, robot seems to be an effective tool compared to the human agents. And we know that going back to the intense role theory that I mentioned at the beginning of the talk, autistic individuals, they may be overwhelmed with the human eye contact. Okay, so basically, I finished most of the studies that our team have worked on during the past 10 years. And so a few years earlier, a couple years earlier, it's 2020, we find that it's quite ready to move to the, to provide the social services for the autistic children. So that's how we translate. I want to talk about how we translate the research findings to practice. So we have come up with the robot drama curriculum for conversation, for narration, for empathy, and actually much more than that. But some other parts of the curriculum have not yet tested. But we can, of course, I mean, in future, we may test its effectiveness. So let me introduce the curriculum and provided by our charitable organization. So we have 5 different levels, fundamental levels, especially for the special schools, that to train these students to improve their self-care. You know, the robots will narrate the procedures, and at the same time, the children will follow those procedures, like packing a bag, cleaning, washing, brushing their teeth, okay? And the elementary level, it is for the kindergarten students, or somehow maybe for early junior primary school students as well. For the prosocial behaviors, how to help others, how to calm down others who are frustrated. We also introduce the daily life vocabulary. We are not teaching them Chinese, but we would like to, you know, help them to communicate better in the public transportation or in the restaurants. Okay, in the medium level module, we have conversation, emotion, and similar to advanced module, but on top of that, we also introduce narration curriculum to the upper primary school children. And we also designed the special topics on sex education, anti-bullying, vocational training for adolescents above 16 years old, resilience, and empathy. Okay, so we have over 300 topics, and I always share with the parents, in case you trust us, you put your kids in our center. It will take around 2 to 3 years to finish the whole curriculum. Okay, and right now the curriculum is in Cantonese, but also in Mandarin and English. Okay, so this is how this is the typical robot drama that we show to the kid. So let me tell you the protocol. Okay, we know that our children should learn appropriate behaviors, but we would like to be clear, to clarify with them or to explain to them why you need to produce those appropriate behaviors. And then we don't want those behaviors are just produced based on imitation. We want them to learn why they should behave in this way. So that's why our robot drama started with a bad demonstration. Okay, so let's take a look at that. It is on the topic on the eye gaze. So the one wearing a dinosaur napkin, feature an autistic boy. Okay, the one with a horizontal stripes is his friend. The autistic boy called Sky, and then his friend called Dash.
Dash, your toy car looks really cool. Can I please play with it?
But not looking at the friend.
Sure. Here you go.
Thanks.
Sky, are you talking to me? You are not looking at me.
Okay, so this is the bad demonstration, and the experimenter could control the direction of the eye gaze of Sky by the remote tablets. Okay, so it is really easy to use. So each robot is controlled by a tablet, and also the all the scripts of the curriculum already upload to the tablet. So it is very easy to demonstrate. So let's take a look at the good demonstration.
Dash, your toy car looks really cool. Can I please play with it?
Sure. Here you go.
Thanks.
You're welcome.
Okay, so after showing the bad demonstration, our human teacher would ask the children either in the individual section or in the group section whether Sky was doing appropriate response, whether the Sky's response was appropriate. We try to prompt the child to think the consequence of lack of eye contact. So hoping that the child would say, that means no communication, or that means Sky was not willing to talk to Dash, or until the point that eye contact is important. Okay, and then the good demonstration will be shown. And then they will practice with Dash to look at the robot. So because we have the eye gaze detection technology, the robots will immediately provide a response whether are you looking at me? I'm telling you a story. Please look at me, just like in the video that I show you. Okay, so we have different delivery modes: individual class, group class, on-site school services, and even online class during the pandemic. And there's some comments from the teachers. Teachers appreciate that our curriculum is really tailor-made, but this is not really tailor-made for that particular child, but because we have 300 topics. So we pull out the lessons that the child will need at that moment. So the teacher will think that we tailor-made for the children, which is good in some sense. And the robots will arouse their motivation to learn. And parents also appreciate the tailor-made design, and seems like the robot training will make the children more interested in learning and being patient, so not easily to feel frustrated. Okay. All right. So, and also thanks for the international and local recognition. Really proud of the team that we have worked hard on in this direction for many years, and then got the recognition in different aspects. All right, so in case you're interested in our work, feel free to scan our Facebook code and also our LinkedIn. Okay, blue is the Facebook, red is the LinkedIn. And look forward to having more exchanges with you. Thank you. Yes.
How big is the pool size of the children for example, neurotypical and
In the studies?
Yeah.
It varies. For the earlier studies published in 2016 or something, it's less than 20 in each group. And for those published later in the year, it should be 30 to 40 in each group. For the empathy study, the latest one, which is 40 plus in each group, around 80 in total.
And then what stage of ASD are they usually in?
Yeah, that's a good question. So we have tested the effectiveness of the robotic intervention in both students with, the autistic children in special schools. So many of them, they have mild to moderate intellectual disabilities. We also run the studies in the mainstream kindergartens and also the primary schools. They have the IQs more than 70. So which is in the normal range. And for the recent studies for the empathy studies, recently published, it is for the high functioning autistic children. So we can say these children need low support, this group, because these children, we need the children to understand the stories. So they need to have a basic level, not really basic, quite a fluent level of the verbal comprehension. Thank you. But still a long way to go for the research, because definitely need more studies and enlarge the sample sizes because of the heterogeneity of autism. But recruitment sometimes is challenging. Yeah, especially when coordinating with parents. Yeah, very challenging. Thanks for your question. Yes. Okay. Yes.
Programs now in the special schools?
You mean on-site school services?
Based on your research, are you now able to implement
Yes, we are implementing on 2 special schools.
In 2 special.
Group sections. So the teachers would coordinate with us, and then they will assign the students they think in need to our sections. But somehow The range, the IQ range is quite big. Yes.
I missed, what age groups are they? Jill, do you have sort of older
Yes.
teenagers in your trial?
For the studies that we publish, usually from 3 to 12, and 3 to 12, age 3 to 12, and similar to our social services. Although we have the modules on vocational training, which will serve those age 16 or above. But unfortunately, so far to date, we don't use that curriculum that much. Yeah. One thing is that, okay, so we designed these modules really hoping that our autistic adolescents would go out and get a job easily. This module trains their interview skills, conversation skills, and how to look for a job. Okay, but somehow in recent years, we find out that helping autistic youths or adolescents to find a job is not that easy. So we don't want to, just train them, how to engage in an interview, but without helping them to move forward to find a job in the market. But this part is very difficult. So that's why we trying to focus on what our strengths, what we can do is 3 to 12. Yes.
Yeah, no, positive reinforcement is heavily inside the study or it's not inside the study.
Well, we actually follow typical behavioral intervention protocol. So after the trial answer question or engage a role play with the robot, we will praise them. But we don't, give any physical awards like a candy or something. We don't. At most, a sticker. Yeah. So it is a typical behavioral intervention protocol.
That compares on the robotic training versus the human demonstration. Are the human demonstration done by like therapists or?
No, done by our undergraduate students.
And also, another question is, are there other people like or scholars doing the same thing around robotic, using robots as a tool as a way to help autistic or other neurodivergent
Yeah,
children?
that's a good question. I know that some researchers in Education University, in Hong Kong, at U in Hong Kong, at U of Hong Kong, some lab, and also PolyU, yes. They also publish a robotic intervention studies, but somehow they would focus on, similar to us, focus on 1 or 2 aspects of the social skills, and then also but I'm not sure that way they can compare robot to humans, because this kind of the design is quite challenging. We need to train the human to do that repeatedly. Yeah, so the easier way or the less challenging way is to have the intervention group to the release control. For overseas, we had come across a few studies a few years ago. But such kind of the studies become, less common or less popular in recent years because robots are quite expensive. And now they are moving toward virtual robots or online games. Or they use different types of technology. Yeah. Yes.
That is comparing robots with virtual robots?
I would love to do that. I'm applying for grants. Yeah, because that would help lowering the cost of the users and then making the robotic intervention more prevalent. Yes. But yeah.
Well, it would seem that more kids are involved with the screen than in the past. So I don't know how long you've been doing your study, but certainly every child I see has a screen in front of them.
Yeah.
So that kind of intervention or that kind of interaction seems
popular.
Prevalent.
Yeah, prevalent, yes. Right now, our team is working on an online game We are conducting empirical studies, testing the effectiveness. Hopefully, the games will be launched in the market maybe in the first quarter next year, because we know the constraints or limitation of the robotic interventions. So the children need to come to our center to receive the classes, right? So which is a kind of quite a barrier to them to receive the intervention. So that's why we want to move it virtual. But instead of comparing, we look using the virtual robot, which was also expensive to program. So we have the online games, but the contents extracted from our RABI curriculum. Yeah, the game called Crown. So in case that next year, if you want to pay attention to it, if you can see, we publicize or promote Crown, CROWN, so that is our online games. Hoping that is serving more kids. Yeah.
There's a question on Zoom. So you mentioned about cost. The question is using robots more cost effective than regular interventions?
If I can assume regular interventions means human-based intervention, well, it depends on the monthly salary of the humans. Well, I would say robot is a fixed cost. And the robots that we are using, I'm not promoting for NEC, but the robots that we are using are quite stable and seldom require maintenance. So it is really a fixed cost we need to bear at the beginning. But we know that not only in Hong Kong, but elsewhere in the world, human therapies are really expensive and limited. So I'm not sure whether I could answer this question directly, but I would say each party will have its own strength. But I cannot really calculate that, robot cost is more expensive or higher or lower than the humans. It's a fixed cost. Yeah.
You are saying, though, that using robots to get responses from kids with autism can transfer to future interaction with humans.
Yes.
So the cost of the therapeutic aspect, you're saying it's cheaper if you use robots.
Yeah, if we calculate it this way. Yes, thank you.
Just looking for where our job is.
Well, but one thing I also need to be honest is that the robotic intervention also needs the presence of the human beings. Although we only need the junior therapists or even undergraduate students could do.
But someone has to be aware of what behaviors are necessary, how to develop those, where they should be at what age, and all those other aspects.
Sorry, can you ask?
Well, the aspects of development of the child. An undergraduate might not have all of that information and skills, so needs direction.
Definitely, they need supervision. But one thing, when we promote our RABI services, let's say to schools or to other NGOs, what they always have to worry that, well, if I assign a speech therapist to the classroom, that will make the whole section more expensive than humans alone, right? And so that's why we program the robots, or we design the curriculum in a way that we could have the junior staff, of course, who has received the basic training on special needs education. And all the, the undergraduate students in our lab, they are majoring in education. So they are pre-service teachers. So eventually, they also need to go to the classroom and teach. So this is also one thing that may lower the cost, yes.
So this robot work is done in a classroom with more than one child?
Yes, we have 4 to 6. At most, 4 to 6 students in the group sessions.
And do they interact with each other?
Yeah, we need them to interact with each other. So this is how we run the robotic intervention. So in each section lasts for 60 minutes. The first 30 minutes is the robot drama and role play. And then the second 30 minutes, no more robots, purely human interactions. So these children are trained to generalize the skills they acquire in the robot intervention to the human to human interventions. Thanks for asking. I need to clarify with that. So that is the quite a unique design in our curriculum. We don't want to wait, you know, for a while whether they, to see whether they could generalize. We want to see the generalization at the spot.
And does this generalization include interaction with each other?
Yes, because we design board games for them.
Sorry?
Board games. Games, board games.
Okay.
The games that they need to cooperate. Yes.
Yeah, okay.
And then to work out the task together. Sometimes our human teachers, they like trigger the emotions for these kids, you know, making them lose a game or someone else lose the game, and now it is your turn, you comfort your peers.
And so these games are done with the robot?
No, no more robots.
They're done with each other?
Yes, as a group.
And so only a class of 4 to 6?
Yes, 4 to 6. Right, thank you. Thank you very much. Thanks for coming. Thank you. So in case you would like to grab the souvenir, you haven't grabbed the souvenir, please feel free. Or you want to grab one more, then also feel free. And hope that we can have more exchanges together in future. Thank you.